They're spreading fear with blatant lies and rhetorical pollution. They obstruct the truth to protect and serve self-serving institutions. There's no other way to say it. We're being lied to and misled into another greedy corporate mess. How many thousands must lay dead before we wake up from this nightmare to the dawn of a new day? We're putting people before profit will become an American way.
This is Democracy Now!, democracynow.org, the War and Peace Report. I'm Sharif Abdul Quddus. As the Senate Finance Committee debates the health care bill today, Democratic Senators John Rockefeller of West Virginia and Charles Schumer of New York are expected to include an amendment on the public option in the bill. Well, we turn now to two groups that say that's not enough. They're calling for a single-payer plan. The Mad as Hell Doctors are a group of Oregon-based doctors who have traveled across the country all months to push for real health care reform. They're rallying in Washington, D.C. on Wednesday. Dr. Paul Hochfeld joins us from Cleveland, Ohio. He's an emergency room physician at the Good Samaritan Hospital in Corvallis, Oregon. We're also joined here in the Firehouse studio by Kevin Zeese. He's the executive director of the Prosperity Agenda. He's helping to launch a national campaign of patients, not profit sit-ins at insurance company offices. There's a sit-in and a rally in front of Aetna headquarters today in New York. We welcome you both to Democracy Now!
Thank you.
Kevin, let's start with you. What exactly are you launching today, this campaign of civil disobedience?
Well, it's three groups that are launching it. ProsperityAgenda.us, which is trying to democratize the economy in the way that Michael Moore is starting to get a debate going about. We see health care as critical to people getting control over their lives in a single-payer system, the only way to do it. Healthcare Now, which is the leading grassroots advocacy group for single-payer that is joining us. And the Center for Poverty, for the Working Poor in Los Angeles works on issues of low-wage workers. And the basic thrust of this is to highlight the denial of health care by insurance industry. Doctors and patients reach an agreement on what they want, what kind of health care is appropriate, and too often healthcare insurance companies say, no, we're not going to pay for that. In fact, there was a report put out by one of the really excellent organizations in this effort, California Nurses Association, that showed that 20% of the time when people have agreed on health care, the insurance companies say no. 20% of the time. One company was 40% of the time. So this is a serious problem. In fact, Michael Moore, when he did Sicko, had 25,000 people write him and say that they were being denied health care. So the goal is to say, get these people health care. We're going to go, and if people who are denied health care want to have the community support them, they should contact us at mobilizeforhealthcare.org, and we will bring people together to go to the insurance company and say to the insurance company, provide this person with health care. These are life and death decisions, and their profits should not be coming before patients. But the overriding message of this is that the health insurance industry should not be seen as a solution to our health care crisis. They are the cancer of the health care crisis. We need a single-payer system, and the Band-Aid putting over the cancer that President Obama and the Democrats are pursuing in Washington is not going to make the situation better. In fact, it's going to make it worse because it's going to empower these insurance companies with hundreds of billions of dollars in annual new revenue by having working people who can't even afford to put food on the table in too many kinds, forced to buy private insurance that's overpriced and pretty lousy product. It's amazing that we're seeing the government forcing people to buy insurance when the insurance industry is the cause of so much of the problems that we face in the country. So people want to get involved in this. We're looking for people to sign up to protest, mobilize for healthcare.org, and come there and sign up whether you're a patient, whether you want to get involved in this. We've had hundreds of people sign up already, and we want hundreds and hundreds more because this is going to be a national campaign.
So you're calling for people to stage sit-ins at the offices of private insurers?
Well, the first thing we want people to do is to go to the insurance and make a demand. Stop the denials. If they refuse a demand, we say we're staying until you make that promise. And it will stay. That means sit in and stay until that demand is met. If it's not met, we stay. We're not seeking to get arrested, but if that's what happens, then the insurance companies have to choose. Are you going to arrest people for your profits, or are you going to provide health care like you're supposed to be doing? How can they say with a straight face, while we're about to give them hundreds of billions of dollars in tax revenue and working people's income, how can they say with a straight face they're going to deny health care? It's going to demonstrate that these corporations are not the solution. Single payer is the solution. And so please get involved. Mobilize for healthcare.org. Get involved. Get active. We need the people to rise up and say, no, we don't want this forced insurance company solution that the Obama administration and the Democrats are pushing down the people's throats.
We're talking to Kevin Zeese. He's the executive director of the Prosperity Agenda. Joining us in the Firehouse studio, we're also joined from Cleveland by Dr. Paul Hochfeld. He's with the Mad as Hell Doctors. He's been driving across the country with a group of doctors from Oregon. Welcome to Democracy Now!, Dr. Hochfeld. Explain why Mad as Hell Doctors.
Well, a group of Oregon doctors are really dismayed and disgusted by the health care reform debate that's not happening in Washington. And what we're mad about is that our legislators are partnering, really partnering with the industry to manipulate public policy so it's more about profits than health. We have a completely dysfunctional healthcare system that to the non-system, to the extent that it's designed to service the insurance industry and the drug industry, and we waste 20% of all of our healthcare dollars on insurance activity, manipulating money and fighting over money, and it doesn't add anything to the product. The insurance companies don't add anything to health. They complicate the lives of providers. They waste 20% of all of the money, and we're never going to be able to afford true universal access in this country, which is a moral imperative, until we get rid of the insurance companies. That's the first step. It's the first necessary step. After that, then maybe we can have a system, then maybe we can have a healthcare administration that every decision that's made is motivated by how do we get the most health we can for the precious money we're spending on healthcare. And our legislators understand this. Unfortunately, they think they need industry money to get reelected more than we think we need a healthcare system that delivers health. We don't have a healthcare system. We've got a sick care system. The way you make money in this system is you treat sick people. There's very little money to be made keeping healthy people healthy or keeping people with chronic diseases from stumbling into the ranks of the ill. And that's going to continue until we put our healthcare system in the hands of public health people. Now, there's a concept.
But this issue of single payer, Kevin Zeese, do you think that there is a chance of it happening on Capitol Hill? Right now, there's a debate over whether to even have a public option. You've been involved in politics for a long time. You were Nader's spokesperson in 2004 in his much vilified campaign for president. Do you think the efficacy of what you're doing right now?
I think that single payer is inevitable. It's going to happen. The question is when. What's being put on the table right now in Congress by the leadership is really not going to solve the problem. It's not going to cover everybody. It's not going to control costs. It's not going to give people the choice of doctors and health providers that they deserve. It's not going to give people security to change jobs and keep their health care. So all the problems that currently exist will be there. It's a Band-Aid over a cancer and not a solution to the problem. So what we need to see to make this, to win this battle, and it's a critical battle for really economic security and democratizing our economy. What's needed is people to get organized and get active. And so this effort, mobilizeforhealthcare.org, is an effort to really get people active and involved so we can make this change. I really think it's inevitable. It's going to happen. It may not happen this year, but whatever happens this year is not going to solve the problem. And I really hope that President Obama would go back to the President Obama of 2003, who favored single payer and who said we had to win the House back, had to win the Senate back, had to win the presidency back, then we get single payer. If we had that president as our leader, there's so many opportunities right now to make single payer a reality. In fact, there will be a floor vote on H.R. 676. Anthony Weiner, the Democrat from New York, is going to ensure that there's a vote on the floor of for H.R. 676, the single-payer bill. So that'll be the first time ever we've had that. We started this debate. We were off the table. In fact, I was one of the Baucus 8 who was arrested challenging Senator Baucus for keeping single-payer off the table. And now we've gone from off the table to on the floor. There will be a floor vote. So we've made a lot of progress. My preference is to see this bill defeated. It does more harm than good. It empowers these corrupt corporations in ways that we don't need. So let's see this bill defeated and start over and make the next election about a national health care plan. That's what the people really want. And if Obama had used this year to educate the public on single payer, he did a little bit of it once in a while when questions were asked at town hall meetings. He admitted it's not socialist. It's the only way to cover everybody. It's the only way to really control costs. He acknowledged all that. But then he goes ahead with this failed system of private insurance that denies care to make profit.
And also, Congressmember Dennis Kucinich of Ohio has passed a measure that allows states to adopt a single-payer plan, which is similar in the process that Canada actually eventually got a national system. But Dr. Hochfeld, you're holding a rally tomorrow, your group, you're driving to Washington, D.C. Are any lawmakers supporting your efforts?